We are live now.
Good evening, faculties member. Good evening, participants. Thank you for joining Shield Connect. And today we are back with our series Icons with Dr. Ritu Santwani ma'am. And today icon is herself, Dr. Ritu Santwani ma'am. And happy Women's Day to everyone. As this is the week of International Women's Day on 8th. So today the topic ma'am is going to take is on Enigma for her. So let me introduce Dr. Ritu Santwani ma'am. Ma'am is obstetrician and gynecologist and IVF specialist, founder and CEO of 360 Degrees Healthcare Studio, and consultant at Inamdar Multi-Speciality Hospital in Pune. Ma'am is infertility test tube baby specialist. Ma'am has been part of NUHS from Singapore, co-founder of MAAM, board member of SWWC. So, I wishing everyone happy Women's Day, and I hand over the session to Dr. Ritu ma'am. Thank you, everyone. Thank you, ma'am.
Yeah. Thank you, Nishan. Thank you, Sahiti. Can you please check program is going live on YouTube or not? Okay. So welcome everyone. Yes, I am seeing in the crowd that mostly we all are women here except Nishant. Huh?
Yes, ma'am.
So woman power. Yes. Hi Rupali. Hello Dr. Monica. Hi Harita. Hi Kanchan. Good to see you. And yeah. Hi Kanchan. Welcome.
Hello, ma'am.
Hi. Hi. Welcome. Welcome, dear.
Yes.
And yeah. Hi Monica. Yeah. Good to see you, Kanchan.
Me too, ma'am.
And who else is on? Yeah. Dr. Frigura. Hi, Dr. Frigura. How are you? So, friends, as all we are aware of that this is the International Women's Day we have just celebrated 2 days back. So, I think we must, each and everyone, we must, just a second, huh? Something is, yeah. So, we all know this New Year's, this time theme is embrace equity. So I think we must greet each other also by saying that Happy International Women's Day. It was actually our day. So now, without wasting much time, I am taking the starting the topic of today, Enigma for her. So friends, before I start this topic, I want to know that how many of you are using the laser in your practice, or you are planning to take the laser machine? No one has answered. Actually, before I start the session, friends, those who are at Pune, 19th of November. Okay, yeah, Harita, yeah. So 19th November, we are 19th November, 19th March, evening 6 to 8 p.m. We are having one physical CME. That is at St. Laurent Hotels, Korego Park. So those who are here are welcome to join. Kanchan is also there, is one of the faculty member there. So all of you are welcome. I will put the flyer soon in the social media. So I'm sharing the screen. Dr. Harita, you are using since how long that laser, and which laser you are using? So we'll make it full screen. So friends, this is my all presentations will always start with Mata Durga Stuti. Ya Devi Sarva Bhuteshu Chikitsa Rupen Sansita Namastasei 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 Namo. So topic, I purposefully chosen this because in this International Women's we must discuss regarding what's the problem are associated with her, what is the enigma for her, and then how can we treat. So innovation and technology for gender equality. We all know this is the theme for this year 2023. So now what are the common her problems, which is the commonest enigma for her? We all know the pelvic organ prolapse, urinary dysfunction, stress incontinence, sexual dysfunction, overactive bladder, fecal incontinence, pelvic pain, vulval vaginal itching and pain, abnormal vaginal discharge, cosmetic issues. A lot of patients I'm getting for the sagging breast, pregnancy stretch marks, vulval diseases like lichen planus, warts, and others. Someone has dropped some message. Okay. Yeah. Oh, why the slides are not moving? Yeah. So we all know there are a lot of new subspecialties are emerging. The female pelvic medicine and reconstructive surgery and the cosmetic and aesthetic gynecology. So we all are aware the causes of tissue aging and laxity, menopause, low estrogen status, pregnancy and childbirth, smoking, obesity, and nutrition. So urine incontinence is more prevalent than other chronic diseases in women. And amongst the different diseases, hypertension, and incontinence. Incontinence is highly prevalent. Post that is hypertension, then depression, and diabetes. So the tip of iceberg is by the urinary incontinence. So lot of patients come with these problems. They show the main complaint is laughing and other stress are more than the stress, because at any can you hear me now?
Ritu ma'am, yes, now we can hear you.
Now you can hear me?
Yes, yes, now we can hear you, ma'am.
Yes, ma'am. Yes.
Okay.
The screen is here.
The screen is visible or not? Or I share again?
No,
The
not
screen is
visible.
visible?
Not visible.
No, ma'am, screen is not visible.
Again, I was not visible. Acha, okay.
It's okay. Can go to Zoom.
Not, ma'am.
हेलो बिल्स नहीं निकाला मैंने ठीक है
Now the screen is visible. Screen is visible. Can anyone revert?
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
Yes,
Now it
ma'am.
is visible.
Okay. Okay. What? Microphones. Now I think it's visible. No, internet is not proper. It's showing internet connection is weak. Am I audible now?
Yes, ma'am. Audible.
Am I
Yes, ma'am.
audible?
Yes, ma'am. Audible.
Yes, ma'am. Ma'am, I think there is some net issue from your end, ma'am.
Able to hear me?
Yes, ma'am. We can hear now.
Can hear now. It's showing internet connection is unstable. How I make it full screen? I have to share again, I think. Presentation mode. Is that is okay? Can I start now? Slides are visible?
Yes, now, ma'am,
yes,
it is
ma'am.
visible
Yeah.
clearly.
Okay. So friends, as we have just discussed, sorry for those technical glitches. So the types of urinary incontinence, as we all are aware, the stress urinary incontinence, urge incontinence, mixed incontinence, overflow incontinence, and atypical incontinence. So symptoms, as we all are aware, the urgency, frequency, nocturia, and dysuria with which the patient comes. And the causes for this incontinence either may be due to UTI or due to some medications or subabnormal growths, polyps, stones, cancer, urinary tract abnormalities, fistula and diverticulum, neuromuscular problems, and pelvic support problems. So here we can see the different types of the pelvic support. So among this, what the advice which we give to the patient? Weight reduction, stop smoking, and treatment for the chronic cough, treatment for the constipation, advice regarding the use of the pads and garments. Then for the stress urinary incontinence treatment, the pelvic floor exercises, electrical stimulation. Conservative treatment is the implants, medication, and the surgery. This is a device is available. We all know that the Kegel exercise is very good. So this Kegel master is available, which helps a woman to perform the proper and effective Kegel exercises by applying adjustable targeted resistance against the muscles of the female pelvic floor. The Kegel master has 15 levels of resistance with a maximum of 4.5 lbs of pressure required to close the unit. The advanced Kegel master has 64 levels of resistance with a maximum of 9.5 lbs of pressure required to close the unit. So this is how it has been used. Then amongst the friends, because this topic is very vast, so I will try to take in nutshell everything. So for this, as we all are aware, amongst the surgery, for this in the vaginal anterior repair, needle suspension, slings, and MUS, while with the urethral bulking agents has been reported, and abdominal MMK, colpo suspension, slings, artificial sphincter. Amongst the laparoscopic colpo suspension slings. With these, with this colpo suspension, the cure rate has been reported 60 to 90%. Whether it is gold standard or not, there are a lot of pros and cons. So some complications which are associated with reported are voiding difficulties, de novo detrusal instability, and the prolapse. Stress urinary incontinence, the minimal invasive surgery, TVT, has been reported. Among this, the tension-free vaginal tape, the cure rate is 60 to 90%. Indications for the primary and failed surgery, concomitant prolapse surgery, complications, bladder perforation, retention and urgency. Bladder injury at TVT, as we all know, the bladder perforation rates 2 to 10%, rates with increased previous retropubic surgery, removal of TVT and the site more laterally. So these are the some, because I'm not going in very deep, again, otherwise it will be a separate topic for the discussion. Amongst these urethral bulking agents, what are reported with the periurethral route and the transurethral route, the cure rate has been reported 50 to 70%, but this is temporary. Amongst this, the implants have also been reported. The implants with the unwanted effects like this, UTI, retention, urge incontinence, among which are not responding to anticholinergics too, hematuria. Then coming to the urogenital prolapse, the pelvic organ prolapse affects almost half of all the women over 50 years. Clinically significantly prolapse 10 to 20%. For majority of the asymptomatic women, no treatment is indicated. 11% chance of undergoing at least one operation for prolapse or incontinence by the age of 79 years. So some studies have been reported. As I've already mentioned earlier also, the treatment for pelvic prolapse, lifestyle changes, bladder training, physical therapy, pessary, vaginal mesh surgery, and new laser vaginal rejuvenation has been reported. So these are the. Then rectal seal repair. Surgical complications, the surgical injuries, organ damage, voiding dysfunction, bladder perforation, pelvic visceral injuries and hemorrhage, mesh erosion and extrusion, urinary tract infections, groin pain and dyspareunia has been reported. Then amongst the postmenopause, we all know this genitourinary symptoms are very common. So take another one. Among this, the vaginal atrophy, the urogenital atrophy is the only symptom that all the menopausal women experience at some point. Among this, the vulvovaginal atrophy, the lack of lubrication, the pain with intercourse, 20 to 45% of the midlife and older women has been reported. Amongst this vaginal atrophy, the different symptoms are vaginal dryness, vaginal burning, irritation, decreased lubrication during sexual activity, painful intercourse, vaginal bleeding or vulval fissures, vaginal discharge, pelvic pressure or vaginal bulging, and different other UTI symptoms. And we all know for this dryness, the lubricants and local ERT we advise. Amongst this, the estrogen agonist and antagonist, and non-hormonal, lot of non-hormonal preparations are available these days, which are having a very good result. Some are having a soya content, some are having a glycerin content. I am finding very good results by using this non-hormonal medications also. Regular sexual activity, laser vaginal rejuvenation has also been reported having a good. So among this, the atrophic vaginitis in the prepubertal, lactating and postmenopausal women all are affected, all which are having the reduced estrogen levels, causing the thinning of the vaginal epithelium. Vaginal epithelium susceptible to trauma and infection. Then again, the pH will be high. So pH 5 to 7 due to reduction of the lactic acid production and decrease in the lactobacilli, decreasing the H2O2. So we all are aware, these are some symptoms which has been reported: abnormal vaginal discharge, pruritus, irritation, burning, soreness, odor, dyspareunia, bleeding, and dysuria has been reported. So for this, as we all know, the treatment which has been advised is the estrogen replacement, vaginal and oral. Then different estrogen creams and preparations has been reported. Then the VR is a vaginal relaxation syndrome, the lax vagina, a very quite common medical condition described as the loss of the optimal vaginal structure and is usually associated with vaginal delivery and natural aging. So friends, I think each and every one of us having a patient of this loose vagina, lax vagina in our OPD. So let me finish this slide. Then I want to know all of yours opinion that how you are treating that patients of this vaginal relaxation syndrome. Again, the slides are hanging. Yeah. So this leads to sexual dysfunction, urinary incontinence, urogenital syndrome of menopause. Then vestibulodynia and vulvodynia has also been reported unexplained pain around the introitus, 1 million cases per year, all ages, hypersensitivity to touch, infections, local cause for unexplained treatment, very different. Then lichen sclerosis. So very commonly we can see these patients. It compromises 70% of benign epithelial disorders, epithelial lining, inflammation, histological changes in the dermis. Then mostly the itching is the main complaint, vaginal soreness, dyspareunia, burning and pain. Signs in the we can see crinkled skin, labia minora is atrophy, constriction of the vaginal orifice, adhesions, ecchymosis and fissures. You can see how in this diagram the ecchymosis and fissures are clearly visible. And for this, the biopsy is mandatory, emollients, topical steroid, testosterone not effective, then petroleum jelly to relieve the pruritus, pain and virilization. So surgery to avoid unnecessarily unless and until and you are doubting for some malignant lesions. Then among this, sorry, this lichen planus, how it can present. So friends, we can see either it can be the hypertrophic lichen planus or it may be erosive lesions at vestibule with or without adhesions resulting in stenosis, may have the associated oral mucocutaneous lesions and desquamative vaginitis. Patient complain of irritating vaginal vulval soreness, intense burning, pruritus and dyspareunia, and types are reported as the papillosquamous and hypertrophic has been reported. So among this, the treatment, what we advise either the intravaginal hydrocortisone suppositories, steroid creams, vaginal estrogen cream, dilators for stenosis, and surgery for severe vaginal synecdoche and vulval hygiene and emotional support. Then for this vulval psoriasis, also the topical corticosteroids have been reported. And suppose if this atopic eczema or neurodermatitis, in this the benign epithelial thickening and hyperkeratosis has been seen. And for treatment for this is Sidspar, oral antihistaminics, medium potency topical steroids twice daily has been reported. Then among this lichen simplex chronicus, in which the appearance of a thickened white epithelium on the vulva, generally unilateral or localized. Treatment is medium potency steroids twice daily. Amongst this benign vulval lump, because we are discussing this is an enigma for her. So lot of other things we have to include: the Bartholin cyst, epidermal inclusion cyst, skinny duct cyst, congenital mucus cyst, cyst of the canal of the neck, cyst especially which gives the hydrocele appearance in the labia majora, sebaceous cyst, papillomatosis, fibroma, lipoma, condylomata. Cysts are either congenital or arise from the obstructed glands. Manifestations arise from the cyst or from infection. So now question comes that what's the new thing we can offer to her? So friends, as we all are aware, the external energy application, CO2 laser, arc laser, radio frequency and ultrasound. So those who are using laser, they must be aware of this Enigma and which is a non-invasive temperature controlled radio frequency device, and in which the energy delivered deeply into the vulva, vagina, and tissue, tightening immediately. And newer and tighter collagen stimulation, new, softer, and smoother skin. So this is non-surgical, no anesthesia, painless OPD procedure, and with the immediate results. Only the main factor is the cost is high. So this we have just discussed. So how it works: heating of the skin and mucosa promotes three different kinds of the effect: immediate contraction of collagen, immediate collagen remodeling and elasticity, and longer term of stimulation of the production of new collagen. So how this works: it increases the blood flow and restores the nerve cell signaling, resulting in normal vaginal lubrication. This has been the thermal neurogenesis concept itself has been quoted by the Ellen Soon. So the treatment time, what is advised is external labia 5 to 10 minutes, full vagina 30 minutes, SUI and OAB 10 to 15, atrophic vaginitis 10 minutes, and cystocele 7 to 10, rectocele 7 to 10, orgasmic dysfunction 15 to 20 has been reported. So the other newer modalities which has been reported, the vaginal laser therapy, which it has been claimed to be having a very better solution for a better feminine life. So, but it all depends. Yes, if you can purchase, if your pocket permits, then it is definitely going to be useful. Just now, Dr. Harita has shared with us that she is using this. She is using the laser. But sorry, friends, I have not used these lasers. I basically treat all the patients. If not via medicines, then in some patients I will try to give this PRP therapy, with which I am finding the very good results. Sorry, slides are not moving again. Yeah. So this is, I'm not going into very deep because this is the two different type of the lasers. How that they are working is detailed as mentioned in here. So this is the different probes which they are having. And Thermia has claimed that the small shape and cannot be reused and slow with a small spot size. So this is, by definition, it is FDA approved, and Pixel CO2 laser designed and invented by the Alma lasers to treat the vulvovaginal dryness, laxity, mild to moderate urinary incontinence, mild prolapse, vulval diseases. And the rational use of using this laser therapy, the different studies have come gradually. Then all these studies have the laser act by photostimulation, photodynamic reaction, and photothermolytic action. Sorry for the spelling mistake. So this vaginal laser stimulates the production of collagen, elastin, and fibroblast activity, treat and improve stress, urinary incontinence, and vaginal laxity and dryness. Then similarly with this arc laser, this is the different details for the laser, but as I have just discussed that most of us are not using the lasers, I'm not going into the deep of these slides. So this is the different vaginal CO2 lasers, which stimulates the production of collagen, elastin, and fibroblast activity, treat and improve the stress, urinary incontinence, laxity, and dryness. Using CO2 pixel laser technology, long-term thermal effect, microablative effect, the golden standard in face treatment and skin tightening. So this is the different details of the laser. Don't want to go in that. Among this, these are the different lasers are available, which in the market. Amongst this, it has been reported that ablates the mucosa and microscopic columns of the thermal damage and penetrate deep into the submucosa. So again, we know how it acts: the thermal damage, superficial shrinkage, and deep ascitic wound, and the collagen remodeling. So acute thermal damage in 48 to 72 hours. Again, the proliferation phase in which the new collagen forms, and remodeling phase, then mature collagen fibers and new elastic fibers has been reported. This is the different details of the laser, so I'm not going to take that, as most of us are not using. Now, how it acts: the thermal effect, proliferation, and then remodeling has been reported. So this is how the collagen remodeling process happens, friends. Then in some patients, the vaginal wall colposcopic image after the post laser therapy, we can see, while the microablative effect on the smooth treatment without damaging or may be carbonized. Then amongst the histology, the vaporized space, a column shape, has been reported, healing the vaporized area. Then collagen regrowth within 6 months of the post-Femi lift treatment. Agar wo sab lagane, if they are using all that things along with that. This is the different histological picture. I'm not taking that detail because today's a curtain raiser. I want to cover all these, the Enigma for her in the short. So the advantages, what has been reported with this, the laser, the non-invasive procedure, it can be used as a coffee break procedure in the 10 to 20 minutes, easy and safe, minimal discomfort and pain, effective and rapid healing has been reported. So these are the different pros and cons with the use of the laser. So different lasers are available in the market. So once the person is coming to be acute, take the proper details from them and then only start. This is with the probe. You can see normal, slim, and smart probe and femtide has been available in the markets easily. So how to use that? The family probe applied liquid lidocaine 2% in the introitus, and we have to wait for 2 to 3 minutes, and then then we have to the minimum 2 to 3 times of the passage is repeated if it is necessarily after 1 month. So usually whenever you are giving the laser therapy, call the patient for follow-up either 4 weeks or 6 weeks. That will be much better. And the vaginal tightening, that's the powerful thermal heating and microablation applied to the various layers of the vaginal tissue in 360 degrees pattern. So this is some studies have been done. Again, for this vaginal wall tightening, as we just discussed, the remodeling tissue throughout the vagina, then how this collagen does the remodeling process, then fractional microablative CO2 laser for vulvovaginal atrophy in women treated with chemotherapy and or hormonal therapy for breast cancer. The retrospective study has been reported. Then for the urethral support also is very important. So this is the different details of the laser therapy. I'm not going to take that because only 1 or 2 doctors are using among this. So the pre-treatment consultation is very important. Complete health history questionnaire, vaginal bladder questionnaire, and complete OBGYN history, including the pap smear results and pelvic examination is very important. So the contraindications only in the conditions of active herpes, abnormal pap smear, active vaginal infection, gynec cancer, undiagnosed vaginal bleeding, uncontrolled diabetes, pregnancy, recent vaginal injury, any active bleeding. So friends, first we have to find out that why it is happening. Then the treatment protocol, as we all are aware, it's the office procedure, no anesthesia, 2 to 3 passages of the entire vaginal canal, 3 sessions, 1 monthly interval, and 1 memory session after 1 year. Just a second. May be repeated after full course after 2 years. Then the non-gynec use, the stretch marks, facial laser, warts, dark spots and moles, scar marks post cesarean keloids. Then evolving indications of operative external and also with the cart laser. This I have made actually one question, but we have already discussed. So I think we can omit this. These are some different questions I have prepared, but we have already discussed each and everything. So the function of this is, we can see among this, treating for these all. And for this vaginal rejuvenation and tightening, now the everyone is approaching for that. Only problem that some patients are having little more side effects, some are having little less. So friends, I think with this I will wind up because the topic is very vast. Still some slides are vacant, but as most of the friends, those who have joined, are not using the laser, so I think I can cut off here only. So friends, I know this topic is very monotonous. So anyone if is having any problem can ask here, but not ask me about this laser. I am not using that because for the stock purpose I have to complete. So I have to add all the important points. What is the major treatment is available in today's discussion. So friends, if any queries, you can write it down here. And besides that, there is one important announcement. On 13th March, sharp 2 p.m. 2 to 4 p.m. I am doing one webinar, which has been accredited by Maharashtra Medical Council, the 1 credit point. So those who want to attend, please, I have posted already the registration link in the chat box. Those who are interested can register and join. Registration is totally free, friends, so no registration charges. And we are going to discuss the practical things in that too. So I think there are no questions. Nishant, we can wind up. I have to rush to the hospital actually.
Hello.
Oh.
Ma'am.
Ma'am, Dr.
Yeah.
Beena.
Hello.
PRP, I will take some other lecture. I've already taken a lot of lectures for PRP also.
Yeah.
For PRP, we made PRP and for give the injections, Dr. Beena. For PRP, we can take the another lecture. Yeah.
Hello.
Yeah.
Hi, ma'am. Dr. Kanchan here. I
Yeah,
just
yeah,
wanted to know how many settings are needed for this laser therapy, na? For vaginal tightening.
For
How many
which?
settings?
For which? For laser or
Vaginal.
for
Laser.
Laser minimum 3 sittings. Minimum 3 sittings, maximum 4 to 5 sittings.
And what are the charges if we suggest some facial?
Charges, those who are using, they can only tell. I am not using, so I am not aware of that. Different setups, the different charges are there. Yeah, some are charging around 10,000, some are charging 5,000, like that. So, but that is not a total cure. We have to explain the patient that till the effect remains. Usually, the effect remains 5 to 6 months, or maybe 7-8 months, like that. So after that, patient again has to do this. Yeah.
So this is a temporary procedure then?
Yes, of course. See, even if we are doing the PRP also, that is also temporary, but the results usually, once I do give the patient the PRP injection, at that time also we tell the patient the result may persist up to 6 months, 7 months, or maybe 12 months, or maybe 18 months. So we have to explain the patient, I have to clarify everything in the first sitting only. फिर ऐसा नहीं होना चाहिए कि later on patient is fighting with us, मैम अभी हमने इतना पैसा खर्चा किया, बाकी पैसा हो रहा है. Yeah.
Definitely. Yes, ma'am.
Yes. Yeah.
Thank
Okay.
you.
Yeah. Peena madam, we actually inject the PRP in the different angles in the different clocks position, and with this I usually find the good results, and but the effect is maximum in one patient I have seen till 18 months, but after that you have to repeat that, because there are associated so many comorbidities. The patients who are coming for the vaginal tightening, maybe 55, 56, or 60. Some are having associated BP problems. Some are having associated diabetes. So there are the different problems are associated with that also reported. So I think there are no more questions. So friends, we are winding off for today. I think
Yes.
Nishan, no more
No
questions.
question.
Huh? Yeah,
Yeah.
yeah. So sorry, friends, I'm in a little rush. I have to go to check one of my patient. Huh? So we will wind off today. So thank you, everyone, those who have joined. So friends, bye-bye. Huh? Bye-bye. Good night. We will meet soon. And thank you, Nishant, and thank you, Sahiti, for always ready to help.
Thank
So
you.
friends, yeah, welcome, welcome. So friends, we are winding off today. If you are having, yeah, thank you, Dr. Mohan. Thank you for joining. And if you are having any questions, you can drop it in the academic box. I will try to revert that. Yeah. Welcome, Kanchan. So it only depends on how your results are coming, how your body is reacting to that. So though every day there's so many company persons are coming and telling that, ma'am, mine is for the 2 years. Others saying mine is for up to 3 years. So with this, friends, we will wind up for today. Bye-bye. Good night.
Bye, ma'am.
Yeah.